We're joined today by Dr. Llaila, Afrika, who is an expert on holistic medicine, naturopathic medicine, and today's subject is arthritis. Dr. Afrika, welcome.
My pleasure,
Nice
Andy.
to see you here.
My pleasure.
Dr. Afrika, what is arthritis? Maybe we should start with that kind of foundation.
Arthritis, whenever you hear the suffix itis, it means inflammation. Arthritis, articulating surfaces, arthritis. Is usually people associate that with arthritis of the elbow, they call tennis elbow, articulating surface, things that move, that get inflamed, arthritis of the knee, those sort of things.
Now, normally when people get arthritis, at least this has been my experience, we take analgesic medicines, aspirin, ibuprofen, acetaminophen, those sorts of drugs that tend to suppress the inflammation. Is this the normal treatment that we understand for arthritis?
Yeah, mostly they focus on anti-inflammatories because we're dealing with inflammation. When you hear the word itis, tonsillitis, appendicitis, vaginitis, that's inflammation. So they take anti-inflammatories. Label would do quite
What
well
are the
with
side effects of the traditional, or what we have come to believe is the traditional treatment for arthritis?
Well, you're looking at anti-inflammatories, and that stops the surface from heating up. When you exercise, the muscle should heat up because it increases the circulation. If you take an anti-inflammatory, it stops things that should heat up from heating up. And that means when you're using your eye muscle or your ears, activity causes the temperature to increase. Now it's going to stop the temperature from increasing, which will retard the whole circulation, and the point of increasing the temperature is to increase the circulation. So when you need more circulation to an area, be it the heart, the eyes, the jaw, you won't get it because you're taking synthetic substance, anti-inflammatory, acetaminophen, ibuprofen, so it's decreasing the body's attempt to increase circulation when it needs to increase circulation all over. That can be the reproductive system as well.
You're saying this, and yet doctors of allopathic medicine, that is MDs, and probably doctors of osteopathy, that is DOs, continue to prescribe or recommend anti-inflammatory medicines for arthritis. Why are they doing that?
That is their training, that's their background. They're not evil people. They're trained differently from naturopaths and homeopaths. And you're going into the field of allopathic medicine, which is known as suppressive therapy. Whatever the symptom is, they try to suppress it. They don't get rid of what causes the symptom. They only suppress the symptom. And that's called allopathic medicine, based on using poisons to cause the body to have a reaction which suppresses the symptom. And naturopathic medicine, coming from the word nature, and pathy meaning diseases, is natural things to prevent disease, which would probably be more herbal, non-invasive, massage, acupuncture, things that don't hurt the body. Homeopathic medicine uses the same things that basically allopathic medicine uses, except they use less. There's not too much difference between homeopathic and allopathic. Allopathic is more, homeopathic is less, and they also use a lot of herbs. But they use a lot of herbs in allopathic medicine as well. 50% of the things in the pharmacopoeia, that's the drug book, have herbal bases in them, with the opportunity to do it. So we give it natural supplements and herbs that nourish the tissue so it can make the decision how to handle this disease.
Now, arthritis, to me, or at least it seems like it's an old person's disease. That is, their joints have finally worn out, they're starting to become inflamed. Is there anything that anyone can do to prevent arthritis from occurring?
Arthritis, there are two types. There's articular rheumatism and there's muscular rheumatism. Those are the old terms of what we're talking about. Articular rheumatism is arthritis. Muscular rheumatism is MS, multiple sclerosis, things that are Graves' disease, Lou Gehrig's disease, things that deal with the muscle. So you're looking at rheumatism, and the subcategory of rheumatism is arthritis, which means there's waste between the joints or decreased amount of fluid in the joints. So if you take in things that decrease the fluid, then you're contributing to arthritis no matter what your age is. And things that pull fluid out of the joint are preservatives such as salt, sugar, bleach white flour, raisins. All of these things require a lot of fluid. What people don't seem to understand is they're eating preservatives, and things get preserved by the loss of moisture. So when you're eating salt, you're pulling moisture out of the joint. So if you go to a regular allopathic doctor, they say, get off the salt. They tell you that if you have high blood pressure, get off the salt. So that you should think, oh, why should I wait till I get sick to get off the salt? Maybe I should get off the salt now. And that's what I'm trying to say. You can do more preventive things. So the salt and the sugar and the bleach white flour pull the moisture out of the tissue, out of the articulating bone structure itself. And that's sometimes hard to understand. The thing is that if you eat a raisin, before the body can digest it, it has to turn it back into a grape. It has to put the water back into the raisin, which we call rehydrating in medicine. So it's pulling the moisture out of the joints and out of the muscle, out of the eyes, out of the ears, to put the water back into the grape, to put the water back into the bleach white flour, to put the water back into the sugar, put the water back. It's pulling moisture from everywhere. So arthritis can occur at any age, 11, 9, 12, 15, 20, whenever you're doing these things.